Hello and welcome to the very first module of our Infection Prevention and Control in Care training course. It's an absolute pleasure to have you here today. In this initial module, we will dive into the essence of infection and infection control, the various types of pathogens we encounter, and how infections spread within our environments. Understanding these concepts is critical for us as carers and professionals who care for the health and safety of others. So let's not waste any more time and get started on our journey. Infection refers to the invasion and multiplication of harmful microorganisms. An infection originates from a collection of harmful microorganisms that negatively affect the human biological system if it's given the opportunity to do so. In more simplistic terms, germs cause disease.
A vast range of different microorganisms exist in harmony with the human race and have no effect on a person's well-being, with many having practical benefits for a person's health. However, many harmful pathogens, such as microorganisms that cause disease, can be found in natural elements and will multiply in certain conditions.
Infections are spread when pathogens are passed from their source to a person or from one individual to another. We will learn about how infections spread later in this module. For now, let's look at the common types of infections. Different types of infections are common in modern society, but the two are the most common.
Different types of infections. 1. Systemic infection. And 2. Localized infection. A systemic infection, such as the common cold or flu, will affect the whole body and cause a person to feel generally unwell. A localized infection, such as an infected cut or swollen limb, will only cause pain, irritation, or other symptoms to manifest in one part of the body. The uncontrolled spread of an infection in a facility or localized area can affect the health of many people in a relatively short space of time. Serious forms of infection can lead to people becoming ill and cause fatalities in some cases. Sounds scary, right? Don't worry, because this is where infection control comes to the rescue. So, what is infection control? Well, infection control is the term given to specific activities taken to prevent diseases from spreading from their original sources and eliminate the likelihood of them becoming virulent in currently unaffected areas. The concepts and principles of infection control are important because of the major impact it can have on vulnerable individuals and groups of people. It can also have a significant effect on the working infrastructure of a company or organization. The more employees that become ill or unable to work, the more difficult it becomes to maintain a quality service and cover deficiencies caused by staff shortages. All of these factors can lead to further issues caused by stress, overwork, and levels of expenditure. This is why infection control is a must. True infection control can only be accomplished when sources of infections are understood, as well as the methodologies for preventing the spread of disease. Colleagues and professionals must cooperate to achieve high levels of infection control and follow their agreed ways of working accordingly.
Alright, so far we've learnt about infection and infection control, as well as the importance of these concepts. It's time to shine a spotlight on the culprits behind many infections. We believe you know what we're talking about. You're right, it's time for us to learn about pathogens. Pathogens are like the villains in our story, lurking around and causing trouble wherever they go.
A broad range of pathogens exist, but there are common ones that are encountered more often than others. For example, bacteria, viruses, fungi. Most people think of bacteria and viruses when types of infections are discussed. Let's get more into these pathogens. The first one is bacteria. Bacteria cause infections by multiplying in large numbers. Bacteria need certain conditions to multiply, such as time, nutrients, moisture, and temperature. Bacteria will typically cause infections that disrupt the effectiveness of internal organs and biological systems, such as gastroenteritis and tuberculosis. Antibiotics and immunization can kill and control most bacteria. Some remain resistant to treatment and cannot be killed. Now let's look at viruses. Viruses are smaller than bacteria, and they can cause infections by multiplying in small numbers. Viruses can only survive within the human body. They do not live long outside the body. Viral infections include measles and chickenpox. Antiviral drugs and immunization can kill and control viruses. Antibiotics do not kill viruses. Finally, there's fungi. Fungi can appear as, for example, molds or yeasts. Some fungi affect the skin, others affect the whole body. Fungal infections result in the likes of an athlete's foot and skin conditions. Treatments are available for killing and controlling fungi.